We have a really exciting agenda today, and we're so thrilled to be partnering with Move Forward Virtual Assistants. In fact, this is their first webinar since launching. So we're so excited to be their inaugural partner here. I also have Jessica Gulish joining me today. She is the face of Spruce. So you are going to get to see a fair amount of her, and she'll be playing the role of Oprah today too, peppering our guest speakers with questions and fun conversation. This session is going to be recorded. So if for any reason you need to dip out or you have to end early, do not worry. I will be sending a message after the event with a link to the recording so you can revisit the material. Trying to think, is there anything I'm missing, Jess? Or does that pretty much wrap it up? Okay, good.
The question and answer is if you guys have any questions, just hover over your screen and you'll see a little bar and there'll be a Q&A.
Yes, perfect. Yeah, that's the best way to get those questions in, and we will be addressing them at the end. We always save time for questions. So write them down as you think of them, and we'll make sure we get to them closer to the end of the session. So on to the next slide, you'll have a quick look at our agenda today. We're just going to touch quickly on what Spruce is. Some of you joining us today may not know, so there's always a little bit of that. And then we'll get into what is Move Forward Virtual Assistants. The ladies joining us today will tell us about themselves and what they've been up to. And the topics up for discussion are going to range from how to ensure HIPAA compliance, learning to thrive in a virtual world, to why live answer may not be the best for your practice, and how you, your clients, and even prospective clients can actually benefit from added support and resources. With that, I'm going to turn it over to the face of Spruce. That's okay. I felt like it was the Oscars music moving me along. I'm good. Yeah, we will take questions. Obviously, that's our last little bullet there. And then let's get back to you, Jessica. We're going to just turn it over to Jess because she can tell you a little bit more about what she does at Spruce and what Spruce does.
Hi, everyone. Thanks so much for joining. I am very excited about today's topic. It's been a topic I've been very passionate about because I've been seeing practices over my time at Spruce. I've been here a little over 6 years, almost 7. And I've been seeing practices, and specifically in mental health, and how they've shifted their workforce and our own workforces. I mean, everybody. So excited to talk about this. But yeah, I've been working at Spruce for 6 years, all things sales. So I've been talking to probably some of you on this call, or you've seen emails from me, or I've been messaging you behind the wall through Team Spruce. But very passionate about helping healthcare and communication and making it more efficient for everybody on both sides. So that's what I'm here for. If you don't know what Spruce is, which I'm sure a lot of you have, we have a very great following, whether you're a customer or not in mental health, but we are a communication software built for healthcare. And we have a lot of mental health, but we're across all healthcare professionals. We do everything from your business in-office phone. So not sure everyone knows, we do VoIP desk phones now. And we do virtual phones with your cell phone, fax, texting, both SMS and secure messaging, video calling, and payments. Also, one of the things that a lot of people don't realize is team collaboration. We really do that the best. And that's kind of one of the reasons we're on this topic today. So without further ado, I'll go to the next slide here. And Carrie, I'll just introduce Meredith and Jennifer. I really want to welcome you for joining. Move Forward Virtual Assistants has been a partner of Spruce, meaning they've been using Spruce with their virtual assistants and their clients for years. And so we wanted to bring them together and share their little tips and tricks and just get our knowledge base. So if you two want to say, one of you want to say a few more words about your company, that'd be great.
Yeah, sure. Thank you, Jessica. Thank you, Carrie. It's such an honor to be here. As Carrie mentioned, it's our first webinar as owners of Move Forward Virtual Assistants. So it's such a privilege to share that first time with all of you. Move Forward Virtual Assistants is a virtual assistant agency that specializes in handling the administrative needs of the mental health industry. So we're a specialized VA agency. Meredith and I also happen to run another virtual assistant agency that we founded called Sparent. So we happen to have a passion for helping practice owners and business owners grow and scale their businesses with the help of really talented virtual skilled virtual assistants. I'll let Meredith introduce herself as well.
Thanks. Well, that pretty much covers what we do. As Jen said, we have this intense passion for helping businesses grow. That's really what our focus is on in all of our businesses is, looking at the ways in which you scale your business through delegation and the ways that we can help business owners to do that so that you're able to work in your zone of genius, you're able to spend more time with your clients and doing the things that you like to do and not all the stuff that comes with running a business. So.
And just, we didn't put it on this page, but if, people like me are ADD and like to multitask, what's your website so they can check you out while they're watching our slide, listening to us and watching us?
Yeah, moveforwardvirtualassistants.com. So that one's kind of a long one, is the one we're talking about today. So we would love for you to visit us.
Awesome. And just, for everyone in the audience, we chatted before, so I'm going to be asking some questions here. And I love this company. They really are capitalizing on, there's a lot of people that are talented and want to work part-time, whether it be just someone that's, not working full-time or someone, maybe a stay-at-home mom that now is like getting back in the workforce. So they really help a lot of people like get into working in that situation. So I love that about this business. So it was really interesting.
Thank you.
All right. So I think now we're going to get into it, but we're going to do one more poll because we like a poll. We like to see who you are so we can best talk about your use case. So our next poll is just tell us a little bit about your practice. I think we want to know, are you working with a virtual assistant already? Are you looking to add a virtual assistant in the next 6 months, or just here to learn more? So answer that, and that will help us. It's just been wild to see over the last 6 years a difference. I mean, I don't think I got asked about a virtual assistant for the first 3 years I worked at Spruce. The last 3 years and exponentially each year, can you work with a virtual assistant? Can you work with a virtual assistant? And you see it in every specialty. And mental health, I think, was kind of one of the early adopters because we'll get into it. But anyways, all right. So 8% are currently working with a virtual assistant. So 6 of you right now, and then 19% are looking to add soon, and another are just here to learn more. So awesome. Well, thank you everybody and welcome. I'm going to close that out and we will continue on. Okay, again, why are we even here? Why is this even a topic? Like I said, this wouldn't be a webinar we would get this many people on 3 years ago. So you two are the pros. Why has this shift happened? Tell us a little bit about that.
Well, I think there's a few reasons that the shift has happened, and it was certainly helped by COVID. So when everything shut down, everyone had to work from home. It was a real eye-opening experience for a lot of businesses and a lot of different industries that they could still do their job without going into an office.
Right.
There was already a lot of technology that would assist in that kind of workspace where, virtual or part office, part virtual, whatever it is. But it wasn't really being utilized. And so then COVID forced everyone to start looking at, how do we do this? How do we keep working when we're all in different places? And then since then, there's been even more jumps in technology and more advances that have made it even easier. And so I think that's at least the beginning parts of it.
Yeah, so I have a question. So I think we've all experienced that people will have virtual assistants maybe in other industries. Why do you think healthcare was kind of, and this is one we haven't talked about, sorry, but I just thought of it. Why do you think healthcare was so slow to adopt this kind of model?
That's an interesting question. I think a few things. Well, I think when people think of therapy, they think of in person. Right. I think for a lot of people, that's what they're picturing from the therapist side and the client side. So that may have been one of the first barriers to entry. And then I think in a lot of industries, and I think this industry falls into this category, people who go into a business because of a passion for the work,
right,
often don't think of the business side of it. oh, I'm building a business. Oh, I'm running a business. Is this scalable? What are the systems I can have? They just start and they do the work that they love to do. And if they're successful at it, it grows. So those industries in general, and it's not just like healthcare or mental health, we have seen the most resistance to being open to that kind of work environment.
Yeah,
I think you're right.
Yeah, go ahead, Jen. Sorry.
Oh yeah, I was just gonna say, I completely agree with Meredith. I think there are just some traditional paradigms that, kind of carried on for a while. And I think just we were waiting on the technology for a lot of this, right? Like,
good point.
you really can't work effectively, decentralize your workforce until the technology is really caught up. But we are definitely there. And it opens up so many more possibilities to therapists with growing practices in terms of where they find their talent, expanding into the realm of using a virtual assistant as opposed to only considering an employed assistant. So those options are really great to have, particularly when you have a growing practice and maybe you haven't evolved to the point where a full-time administrative support team is right for you at that moment. So I think it's all just so exciting that these options exist today. And it's something where we see just such explosive growth with these practices that are adopting these virtual teams that are allowing them to focus on their core work and efficiently grow their practices.
Yeah, definitely. And I think one thing to note, and I kind of saw a question come in, so it's kind of related to that, but I just want to be clear, is like the technology wasn't that your entire practice needed to modernize, but it was that there's tools to now have calls forward to someone in a different city. There's tools to make your phone number show up from any phone number, or there's a way to securely text each other about a client, even if you're not in the same room. We all, not all, I guess, aging myself, but we all remember maybe those, in doctor's offices, there's those like little triplicate forms that used to have the call notes, right? No need for those anymore. We're in a digital era. So even if your practice is, still on a landline, you can still use a tool like Spruce or a virtual assistant, generally. So, okay, the one other thing on this slide that I thought was important, like I've done a ton of webinars with different mental health consultants. So they're telling people how to just run their business more efficiently. They're not even offering their services to run the business like you guys are. And over, I always hear like, don't do stuff that you can be doing therapy with, pay someone to do this thing so you can get your billable hours in. So, we put some bullets here. So tell me a little bit about like kind of how you talk about that with your clients.
Yeah, absolutely. We hear this, all the time, but it's easier said than done. I mean, if you're have a solo practice and you're used to handling everything, from intake to the session hours, to the billing, to the client communications, you have everything up in your head, and it's hard to imagine somebody else helping you with those things that you are so good at and so familiar with. But as your practice grows, you get less good at those things because you don't have the time to respond to your client referrals in a timely manner. I talk to therapists all the time that are so impressed with our response time. They're hoping that we do a 24-hour response time because they're lucky if they get back to their emails and their voicemails in like 48 hours. And we actually respond much quicker because we're focused on those things and we're good at those things, and we don't have to divide our time between session hours and everything else. So there is a bit of a letting go of that control.
Totally.
And we have, mechanisms in place to make that process very streamlined and effective. Everything from documenting the procedures within the practice, and building those sort of like bridges of trust over time so that as they let go of those responsibilities in their practice, they can feel that relief and then, leverage that time to do other things.
Awesome. Well, I think everyone's here because they probably see a need. So I think we can we can move on, but we just wanted to agree with all of you that decided to come today, that it is a need. So, all right, so let's talk a little bit more about this. So how does it specifically benefit the clients and the therapists?
There's so many ways, and it is a little bit different from, practice to practice, but in general, one of the biggest impacts that we see is it frees up the therapist to spend more time doing clinical hours, spend more time actually treating patients and not returning voicemails and looking at their email and calling insurance companies and doing all of that kind of stuff. And so I think for a lot of therapists, it makes real sense, especially if you look at that return on investment for an hour. So what do you charge for an hour to see a client? And what would you be losing if you spent that hour on work? So, or on this kind of work, on this administrative work. So we free you up from that, but also there's something very draining about working in tasks that are not your zone of genius, that are not the things you want to be doing. And there definitely are practice owners who are also entrepreneurs, who are also business owners, and don't mind doing some of those business owner tasks. But for the most part, these are people who just want to help people, in the mental health field. So they don't want to be doing all this other stuff. And it's not just that it takes time away from treating patients and clients, but it's draining, it's exhausting, it's sort of double the amount of impact. Not only have you lost this hour of time, you could be not only just seeing patients, but just taking a nap, being with your kids, watching TV, like who cares, sleeping.
Or as our therapist, our therapists all tell us, self-care.
Yeah, exactly.
Their own time, so a little of their own medicine, right?
Yeah. So letting go of those things to give us all that free time to do all those kinds of things, and just takes all that the pressure of doing these tasks that are not your focus.
Totally.
Yeah, I was talking to a client just this past week, and she shared that, a potential client, I should say, she was sharing with me that a little over a year ago, she lost her virtual assistant, not with us, but the virtual assistant took another job, and she decided to save the money and just, run her practice herself. And that's what she's been doing for a little over a year. Well, what she found is she could take only about 50% of the session hours without a virtual assistant, because she was spending so much time on the administrative demands of her practice. So not only did her revenue go way down by 50%, but she was also exhausted. She was falling out of love with her practice. She was kind of like constantly stressed, overwhelmed. She couldn't leave her practice. Even when she physically left her practice and went home, she brought that practice with her, because she was, still concerned about, emails and voicemails and billing and everything else that comes along for the ride when you have a successful practice. I always say it's a good problem to have. If you have these problems, it's because you have a successful practice. It's just also a sign that you need to get help in order for that success to reach its next level, and for you to really have a sustainable practice that supports you both financially and spiritually. If that makes sense.
Yeah, no, it totally makes sense. And actually someone just asked, and I think it's appropriate because you're saying you're just talking to a prospective client. And when we talked this week, I joked about that I feel like I'm a therapist for people starting businesses or running businesses, and as do you guys.
Yeah.
Someone just asked, do you help them decide what they need?
Yeah.
Yeah. So you do down your prospective call, and then you go through and just kind of evaluate and then kind of give a solution. Is that?
Yeah, absolutely. So it just as part of our process, we do something called a needs assessment, and it's a longer call than our discovery call, where we really sort of dig deep into the needs of the practice. The practice's personality, core values. It's a deep conversation. But part of that is prioritizing what is important in that practice at that moment. So for instance, we onboarded a new practice. They really need help with scheduling, but they're also 2 months behind in billing. So we prioritized getting digging them out of the billing, because getting that cash flow coming into their practice is going to be really important as we're, starting to help with the scheduling as well. But we have to look at what is the most important thing in the practice at the moment so that we can, help them the best, in the best way possible. A lot of times when practices come to us, they probably should have called us 6 months ago. So, they've been hanging on by the skin of their teeth and they've kind of reached peak overwhelm. And so, Jessica, you mentioned sort of being acting as a therapist yourself.
Yeah.
I feel the same way, help is on the way. It's, you can almost see the shoulders lower once they realize what we can take off their plates.
The parallels there to my discovery calls with therapy offices or, our clients that come to Spruce wondering, can you help my phone system? Can you help my texting? Can you help us capture more clients? It's so similar to what we do as well.
Yeah.
So funny. You do have to do that. Let me hear what's going on in your practice, what's working well, what's not.
Yes.
And here's my solution because we do it every day.
Yeah, and I love the stories only because I'm hoping that, everyone in the audience can probably relate to some of these stories.
Yeah.
But another, client that we are onboarding, I remember in our conversation, she said, I am hanging on to Sunday, desperately. She was hanging on to just having that one day off because her other days she was working 12-hour days.
Yikes.
And I was like, we can do better. We can do better than that. We can do better than just one day that you barely have. You need to bring your best self, to your clients. It's really hard to do that when you yourself are stressed, consistently stressed, overwhelmed, overworked, and there is a better way.
Yeah. Oh, go ahead. Sorry.
I was going to just jump on that from on the side of the anxiety that can come with especially if you've never delegated, if you've never brought on help before. I think a lot of people are very nervous about what's going to happen going into the discovery call. Are they going to be, pushed for maximum hours? And, for us, we really, really believe, and we've learned this in the years of running virtual assistant companies, that it does not serve us to pressure a client into more hours than they need. It just becomes a stress for everybody, ourselves included. So we actually generally counsel the lower end of whatever we think is going to work. And then you can move up. Right. But just in case anyone is, feeling like walking onto a car lot, right? And you have to be like, I don't need a car. I'm just shopping, because you don't want to be pressured into it. And so that is not the way we operate. And so hopefully that can alleviate some of the anxiety that might be occurring.
Yeah. I did want to move on because we have lots to talk about, but I did want to just point out the other main benefit is the clients. They get faster response times.
Yes.
They're going to feel more efficient and cared for, and you may get more clients because they're being responded to sooner, and by adding someone to help get to them faster. So that's, the very big end goal is that your practice is successful and the clients are happy.
Yeah. And more than that, we're a specialized agency. So our VAs are trained within the mental health world. So they're keen to the sensitivities of the work. And, sometimes the hurdle to getting help is not being able to envision that somebody else can take as good care of your clients as you can.
Yeah.
But that's just not true. Not only are VAs highly, skilled and trained in good client care, but we can also lean on your scripts, templates, things like that you can provide. So as a practice owner, you have so much control over the process, probably more than you think. So that we can take really good care of your clients until they get into session with you and even after.
Right. Good points. All right. So, I see a lot of questions coming in and I love those questions, but I'm going to save those to the end. So I just want to let those people know that put those in. Thank you, and keep them coming. But I'm going to address those specific ones towards the end. But I think this will help kind of give you an idea. What do you have to consider when you're hiring a virtual assistant? I know, we work with tons of different virtual assistant companies that use Spruce. So what's kind of your advice on what you should look for that the virtual assistant company has, or the assistant will actually have?
Well, one thing that I think, and we didn't Jessica, we didn't talk about this before even, but it occurred to me
Yeah.
is that there's a different to consider whether you're just going to directly hire a virtual assistant or you're going to work with an agency that will provide a virtual assistant. So that's kind of the first step, and that the benefit to the agency is that there's much more stability. So, you know, if something happens, if the virtual assistant goes on vacation, there's someone who fills in. If, you know, circumstances change, hours go up, hours go down, like we can make those adjustments. There's like a backfill, a team behind the person. So that's just something to think about when you're starting this process. Virtual assistant, do you want to hire them yourself, you know, or go through an agency? And what can you get with an agency? The next piece, I think, you know, just looking at this checklist, but the standard operating procedures, and just talk about this quickly because we could talk forever. But it would, any case of delegation, anytime you are handing off work to anybody for any capacity, you want to have an SOP in place that documents the process, the details, the passwords that might be needed, the steps, that kind of thing. It makes it so much easier to let someone else do the work. And it doesn't have to be every detail, it doesn't even have to be pretty. It can be a video, it can be just like, you know, bullet points. But having that process of documenting what you're doing is going to make that transition to bringing on help so much easier.
Yeah, makes sense. Okay, let's continue on. What else on this list do you want to speak on?
Well, you know, HIPAA compliance is obviously, you know, incredibly important. It's something that, you know, we pay a lot of attention to. All of our VAs are HIPAA certified. We have a HIPAA compliance officer on staff, and we review best practices on a continual basis. We have our strategic partnership with Spruce, which allows a HIPAA compliant, you know, phone system so that our VAs can, you know, go in and out of practices and manage their communications within that and be 100% HIPAA compliant. So that gives us a lot of confidence in that tool. And we love working with Spruce and our clients in that way. So, you know, sometimes I think, you know, our HIPAA compliance protocols and standards are sometimes higher than our clients, but, you know, we're okay with that because we are protecting ourselves, but we're also protecting all the practices that we support. And I think, you know, specialized training in this particular industry is important. Sometimes we are the first voice on the phone with your clients, and those clients may be in crisis. So again, knowing how to be professional, maintain boundaries, get the person the help they need. You know, I always say not everybody can do this job. It's a very highly skilled work that we do. So I think, you know, having a VA come to the table with that specialized training in this industry is really important, not just for HIPAA, but, you know, because of the work the nature of the work. Totally. So we have a 4-week internal training process, but we also hire people that have some sort of experience in the mental health world before they come to us. So that training, I think, is really, really important. And also, you know, just looking at the reduction of turnover. I think if I ever hear anything bad about virtual assistants in general, it's that, you know, there's a high turnover. Sometimes clients come to us, they're like, oh, I've had 3 VAs like come and go. And again, that's, you know, part of the reason we can provide that stability is because we are an agency, but it's also because we take really good care of our team. They are employees of ours. We have a 30-hour work week. We have, you know, we have 4 weeks of PTO. We have great, you know, great benefits. And so it's really important for our great team to be happy with us. And so we have a pretty low, almost 0 turnover of our team, which translates to really great, consistent service for our clients.
And I just would add to that, you know, again, and looking at bringing on someone, you want to really, really think about how many hours you need, like how many physical hours you need to interact with that person. And especially if you're transitioning from having like an administrative person in office and they're just, you know, there all day and they're like doing all the stuff to virtual. The benefit to virtual is you only pay them when they're working with our agency. So but that means you don't just have this whole day stretching in front of you to like throw work at them. So it's thinking about, I think this work can get done in 5 hours a week, 10 hours a week. And that is sometimes a mental shift that practice owners have to go through. So it's important to think about it. But it's much more efficient. It's much more cost effective to be able to do it that way.
Okay, you brought up a ton of questions for me and a few from the audience, but okay. So first, someone just asked who the VA that we're talking to today is. So again, it's Move Forward Virtual Assistants. You can find it at that URL, Move Forward Virtual Assistants. And just to be clear, we're trying to tell you how to choose a virtual assistant. Move Forward is one of the many partners we work with. There's a ton of different virtual assistant agencies and individuals out there, and so we're kind of giving you all the tools to figure out what's best for your practice. And giving you one example of one that we work with a lot and that specializes in mental health, since that's what we have a lot of clients under. Question. So if I'm a therapist, if I'm a practice, can I sign up for 10 hours? Is there a minimum? Do you have blocks? What's kind of, what are that?
We do have a minimum. It's 20 hours a month. We work on a subscription basis, which is just means that we are month to month with our clients, but it's not a long-term contract. So our subscriptions start at 20 hours a month. And if you break that down, that's only about 5 hours a week. And so it's pretty easy to use 5 hours a week up in most practices. So but it's also a pretty gentle starting point if you are delegating to a virtual assistant for the first time. I think Meredith mentioned earlier that sometimes just the act of delegating for the first time can be its own source of overwhelm. And we don't want to, we're here to lower that overwhelm. So sometimes coming in at 20, even if you think you need 40, is the best move, because you can't always just delegate everything all at once. It's just not practical.
Totally.
Yeah.
Okay. And then another thing that someone asked that I think should be on your checklist, like of what you need, you have to think of what your needs are. And a couple people asked for some needs. So I thought I'd ask, this is something, if you need a bilingual VA, that should definitely be on your checklist. If you need a bilingual VA, then you need to find a virtual assistant that's bilingual. Do you guys happen to have bilingual virtual assistants today?
We do have some, and it is something that we, kind of continually screen for in our applicants, because, we're, a global society. So, that's something that we get requested a lot. Also, our VAs are really good with Google Translate. So we have practices that have multilingual therapists, not just Spanish. And so doesn't help with the verbal communication as much, but certainly with, the written communication, Google Translate's pretty handy.
Okay. And I'm going to keep moving, but I did want to say one last point about what to consider when hiring a virtual assistant. And, this is sponsored by Spruce as well. And so efficient systems and HIPAA compliant tools, like a huge thing why Spruce works, why we have so many practices that use virtual assistants on Spruce, is because we allow you to communicate securely virtually. You can assign voicemails and text messages to your therapist virtually. You can have little notes internally to your therapist, to your VA, back and forth, and you can forward calls and mask. So have your main number they can call from their cell phone and have it show your main number. And then third, the documentation. You see when the virtual assistant has called, has text messaged a therapist. So literally you can take a glance when they're not even on their hour that they're working and see everything they did. Like there's just no question. So I just love that, because we use it internally and it's just so helpful for me to know somebody else called someone back and they're not just waiting for a call back. So just had to do my little, plug for Spruce.
You should.
It's a great point. And we've had a couple practices, small practices come out without any kind of virtual phone system, and we can't work. We have to, the first thing we do is get them set up on a phone system, preferably Spruce, because you do have the most functionality. But that's not even just like a plug. That's like a legitimate issue. Have to have this, a phone system like this.
Yeah.
And HIPAA compliance, I also feel like I'm a HIPAA compliance consultant over the last 7 years. And that's the key, is just don't worry, like hire people that are trustworthy in that topic. And how do you know they are? Because 100% of Spruce's clients are in healthcare.
Yeah.
And so we have to think about it. Same thing with Move Forward. And so, you know, you may go to a generic all business phone system or all business assistant, but they're not going to maybe be the experts that you want. So you don't have to think about it. So another thing that I coach on a lot. Oh, and speaking of, I should start a side gig coaching, but I don't. I work full time at Spruce. Do you guys also offer coaching, like yourselves?
Somewhat. I mean,
We're unofficially for sure.
yeah, absolutely.
Okay. All right. Well, okay. So this one's, so this is a very specific kind of question that comes up a lot, I think, when these two are coaching in their sales process with practices. So people think they need someone to answer their calls. Do they?
Yeah, not most of the time, not most of the time, not. And I have to say that I'm getting less and less of a request for live answer because in reality, most private practice owners are not doing live answer themselves. So we do what we call a monitor and respond. So we monitor all the communication channels in a practice, whether that be, you know, voicemail, email, text, you know, website forms, and we respond to them in a timely way. So our client promise is 3 business hours or less. And what we find is that, you know, one, it really protects boundaries. I've talked to a lot of therapists that once they get on the phone for scheduling with their own clients, you know, all of a sudden the lines get blurred between a scheduling call and a session. And of course, because we're, you know, the therapists are helpers and they want to help. And so it's really hard not to get sucked into that. So I think it really helps boundary protection for the therapist to themselves, particularly not answer their own phones.
Yeah.
So yeah, the other piece of it is the efficiency. So when we first started, we were getting a lot of people really wanted live answer. You know, I know we had some discovery calls that ended as soon as they found out that we didn't do live answer. And there's a notion that that's the best, only most professional way to serve clients. And so we've been, you know, really looking at like, is it though? Like, and so part of it is because if you want live answer, that means someone has to be available all the hours of your business waiting for the phone to ring. And if your phone isn't ringing every minute, then you're paying for someone to sit and do nothing, essentially wait for the phone to ring, wait for it to happen. So that's a budgetary issue,
Right.
particularly when we're looking at virtual assistants. But the other piece of it is more and more people don't want to call.
Yeah.
Don't want to talk on the phone. So streamlines efficiency, speeds up the process so much. By moving away, by letting go of the attachment that you have to like the fact that someone can call on the phone will just be answered, because it means that, you know, you can have just returning a bunch of phone calls and say, yes, we're available this day. Yes, we can handle this problem so much faster than an actual full-blown phone call, especially because most of the time when they call back, the VA is leaving a voicemail for the patient. So it's like,
Totally.
also opens up for exploring other ways, having online forms. You know, I know some practices where it's 100% virtual, it's 100% through the website. There's no person-to-person contact until they have been, you know, until they're seeing the therapist. And it makes it so quick, it's so efficient. The calendars just fill up for all the practitioners. And so that's where it starts to become so much more efficient and so much more flexible for growth, for changing of, you know, team members, that kind of thing.
Yeah, definitely. Yeah, I think, and I just want to be clear, you know, you guys do offer live call support, but these are some of the reasons that you guys are seeing a more shift to the asynchronous support.
Yeah, it's rarely in anybody's budget to really support. And if like a VA is in the practice at that moment, like they're in their Spruce system and they're looking and the phone rings, they'll answer it. Like they're right there at the phone. Mm-hmm. It's, you know, it's not like they're going to ignore it. It's just that that's not their whole focus. It's just like waiting for the phone to ring.
Totally. And when you introduce messaging and texting with your clients, this is way easier to do asynchronously and just go back and forth because no one answers the phone anymore.
Exactly.
I hear this every day. So
especially depending on who your demographic is, you may get zero phone interaction if you're treating young people, for example.
All right, well, I'm going to keep moving along because there's a lot of good, like, specific questions I want to get to. And some of them were, what can you guys do? What's it look like to have a VA? So my slide is perfect. So we just put this together. This is kind of a generic one-off of what a virtual assistant from Move Forward has done in certain clients. And if you want to walk through this, you can, and you can also read along, and then we can move on to the next slide shortly after.
Yeah, absolutely. It's certainly not an exhaustive list, but these are some of the more common things that we see, and they tend to center around scheduling, insurance, and billing, and then social media and marketing support is kind of in fourth place there.
Great. Yeah. I have some specifics here, kind of about a day in the life. So do they have, it vary? It probably varies per, a lot of these questions are super specific and it's going to vary, but do they have access to the like EHR?
Yep.
Okay. So you just give them access. And do you guys, if someone were to inquire, do you have a list of EHRs that you're used to working with, or if not, you just have a training session, or how's that work?
Yeah, I mean, we're really familiar with like the mainstream EHRs, Therapy Notes, Theranos, Simple Practice. But, some of our virtual assistants have, years of experience, administrative experience. And so we've seen a little bit of everything, I feel like, although it seems like every week I hear about one that I haven't heard of before. But their learning curve on any EHR is going to be pretty short because they're so familiar with the ins and outs of how these electronic health records work. So I wouldn't get too hung up on, I need an expert in, my EHR, because they will pick up on it pretty quickly.
Yeah, the ones that I just heard questions about, I hear all the time, Therapy Notes, Intake Queue. So those ones are very common.
Absolutely.
And all right. So, and then what about updating kind of like a mail, a WordPress, or I don't know these terms, maybe you guys do. Listing Pro or Medical Pro theme on WordPress using Elementor editor. Basically, I think this is like editing your website.
Yeah, website. Okay. Yeah. Elementor Pro is a way of editing WordPress websites. So definitely we have, especially as we've been expanding and growing our team, we're focusing on adding a few VAs who have generalized business support knowledge in addition to their specific experience with mental health and medical background, because we're getting more and more of these requests to do sort of general business support, mailing lists, sending emails, updating websites, that kind of stuff. So yes, and again, all of our virtual assistants are super smart, super experienced, super quick, and so can generally teach themselves anything that's like very specific or a little outside the norm really, really fast. So
okay, and I see in here work on various projects, payroll, etc., benefits. So someone asked, can your VA help with navigating insurance claims and contacting insurance companies?
Oh yes,
I know they
yes, we do a lot of that. We have a whole insurance team, and believe it or not, the VAs that are on that team, they love the work. They love it. And it's going to sound strange probably to your typical therapist, who would probably rather do anything than sit on hold and try to track down a denied claim, but they're like insurance detectives. They are really good at what they do. And I'm so glad to have them because they do really important work. So that's a definite yes from us.
I figured that was true. Yeah. Okay. Okay. All right. Do you help? This is a unique one. Do VAs generally, or you guys, help with getting new clinicians, their NPI numbers and credentials and insurance companies and all of that? Or have you done that? Or
we have done a little bit of that. I believe we've done some credentialing. There's certain things a VA can do and certain things a VA can't do. It just has to do with requiring specialized knowledge. So our VAs can't do your bookkeeping, right? They can't like do your taxes because they're not
That
CPAs.
makes sense.
But they can gather up the receipts and they can gather up, they can print out like your credit card statements if you want them to, like that, you know what I mean? So like they can do some of the stuff. So with credentialing, they can, and we have done this where they can sort of track the process and follow up, and you have to call because you didn't hear back, and that kind of stuff. They 100%, we have done that. And then probably some other nuances within that. It's just sort of like, sometimes with those, it has to be parsed just a little bit of what they're able to do, but we'll do as much as we can.
Yeah.
Right. Or if there's a process, SOP, you could say, hey,
Yes.
if you were to do this, how would you do it? Write it down.
Mhm.
And then you give that to your VA, you work with the VA to do it. And then if
Mhm.
it's something that you guys haven't done, you guys could create a more robust training for that so others could.
Yeah.
So, and someone also asked about SOPs. So standard operating procedures are literally like, if you were to do something, just write down every single step.
Exactly.
So, and they can help you, guide you if you've never done one.
Yeah,
And
we have a really good system for that, actually. I mean, yeah, SOPs, standard operating procedures, just tedious detail about everything that is done repetitively in your practice. We have both an SOP course and an SOP template, which
oh, cool.
the clients can just copy, paste, fill in the blank. Yes, it takes time. Nobody likes doing them, but we can help get you to the finish line. If you can get the meat of the SOP done, we can kind of fill in the blanks for you. And then it becomes an ongoing living document that is an asset to your practice as you continue to expand. As your administrative team evolves and expands, then they're going to be leaning on that documentation forever. So I really can't, it is the unsung hero of a scalable practice, the most boring document and most boring task ever, but it has so much value.
Yeah, I know. I created a document that I literally would just write down everything I was doing in the day. Right before like we hired someone to help. And so that helped me once I was like going to train them, because like you forget all the little things you do and where you go to find
Yeah,
them.
well, most practice owners have so much up in their head, and that's why they can't imagine anyone else helping them, because it's all up here. But once you get it down on paper, then all of a sudden that delegation becomes possible and so much easier, because once we have your SOP, the virtual assistant, if they have a question, they can turn to the SOP first,
Totally.
which means less disruption in your day with them having to ask you for help or questions, because it's documented. They have that resource right there.
Definitely. Yeah, it really helps, because you have so much in your head, especially if you've been doing it all yourself. Totally.
Yeah.
I mean, we're a small company, as well. I know we seem really big sometimes, but there's a lot of things we do. So okay, one more question about like what they do, and then I have some generic questions. I just want to reiterate here, so they can work on social media, website, blogs, right?
Yep.
Great. Okay. And all right, let me go to the next slide. So I just wanted to talk more, we're trying to just talk generically about virtual assistants, because your practice needs to find the right virtual assistant and phone system that's right for you. But did just want to briefly just talk again about what Move Forward, just because they've been so nice to be on this webinar with us, on their differences, that they are dedicated to mental health. They have the HIPAA certified virtual assistants. They offer fair pay. They're employees versus contractors. So that's going to have more longevity. In their proactive communication standards, and the agency supported versus freelance. I just was going to run through it. And obviously Spruce, you guys, most of you are customers probably on here, but it really does make a huge difference that a voicemail shows in and you just digitally assign it to a different person, and instantly it's in the therapist's hand or the virtual assistant's hand seamlessly, and context is all there. And then just that we're built from the ground up for HIPAA compliance is hugely important, because you're talking about patient information virtually. So you need to make sure it's secure. And then the documentation, I think, is another huge benefit, as well as you can share one number or you can get an individual number for everybody. So it's flexible to your practice, because as we said, we have to do that needs discovery, like what does your practice need? Yeah, and so that's all of that. Spruce also has help center articles on virtual assistants and how to use Spruce in multiple accounts and like all this stuff. So if that's how popular it is on, and then I just unless there's something else you wanted to add. Oh, someone wanted to, again, Jen and Meredith are the owners of Move Forward Virtual Assistants. They help set up virtual assistants in mental health practices with this business. They're not coaches, except for during the process, they will be coaching you in a sense. So, but they are not actual coaches, but maybe one day, but they're busy enough coaching while they're kind of getting you onboarded with their assistant. Okay, so, and there is a recording, there will be a recording of this. Someone just asked, so I just wanted to say that. Anything else to add to this slide? Then I'm going to just get to the questions.
One thing I'll just add about one of the things that we love about Spruce specifically is it does let us, for some of our larger practices, we use teams, of VAs, and some of them, because they're so busy, do live answer. And Spruce is the only system we found that will allow us to roll a call. Yeah. So if it hits the first VA and she's on another call, it'll run to the second VA, or roll the third VA. That was a game changer in our ability to meet the needs of our clients. And so that's just, I want to make sure that got mentioned.
Yeah. All right. So what does the onboarding look like for a virtual assistant?
Yeah, we have that down to a pretty good science. I mentioned the needs assessment, which is really a way for us to prioritize the needs of the practice and get to know the practice's, individual personality. We take the matching of the VA and the virtual team really seriously. All of our VAs are great. They're not necessarily great for every practice. So we really want to make that holistic fit. Once we do that, we do that with the help of our team leads. I think they're in our audience today. Becca and Lorinda, hi. Our team leads are our most experienced mental health administrative professionals. They are now leadership in our virtual field. And they, along with your virtual team, will meet with you for a professional onboarding, and they basically walk you through, like if you need your phone system, Spruce set up, they know how to do that for you. So they can even take that piece off your plate. They'll review your SOPs, and then they will talk about getting into access into your EHR, emails, all of that. They have a game plan going in, and we try to get every practice up and running as quickly as possible. And then we have benchmarks for success that we've identified during the needs assessment. They get revisited at the end of our onboarding period of 6 to 8 weeks, but also along the way, we're continually checking in to make sure that, the engagement is successful for both, the clinician, the therapy practice owner, as well as our, virtual team. We want to make sure that everything is going smoothly as possible. So, and if not, we want to jump in and be a resource to help correct anything that might not be going smoothly.
Thank you. A few people had that. And another question. So I think that someone asked, like, do you have to add them as a user in your EHR? Does that cost extra in the EHR? From my understanding, it would depend on the EHR, right?
Yeah, I believe it does depend on the EHR, but yeah. Okay,
so you guys will have all these answers. So if you message your, Move Forward, I'm going to get their contact info soon, or or research when you're researching, ask these things, like and
ask your
find
EHR.
out. Ask your EHR. Yeah. And with Spruce, you will need to add a new user for the VA, because they're going to be in there like working, and they will be a new teammate, and you will pay for them, but it's just a separate user. Because then if they do leave, you can remove them from having access to your PHI, all your patient information. Okay. And we will be emailing everyone a recording of this. I just got the question again. Okay. Okay. So the VAs, will they be able to, have any of your VAs helped set up like a phone tree on Spruce for a client?
Absolutely. Absolutely.
Yes. Okay. So they can help with that. They can pretty much do everything you can do in Spruce, essentially, if you want them to. You can also in Spruce at least make privacy rules, but they're basically supposed to trying to do anything you want them to do. Like, so if you're doing a phone tree, they can do the phone tree. They're uploading files, they would upload files for you. They would update your social media. So it's an assistant, right?
Yeah, it's the only way, the closest we've ever come to being able to clone ourselves is having an assistant. So
right. And then I'm going to since we only have a few minutes left, I think I answered most of the questions. And if they're specific, I would highly recommend, you go to moveforwardvirtualassistants.com, and there's going to be a list of services they offer. There's going to be, I assume, an email there and contact information. Reach out with those specific questions. Someone has a coaching company and they want an assistant for their coaching company. That's totally something you can help with either one of their businesses. So just ask them there. Obviously, if you don't know Spruce Health, go visit our website at sprucehealth.com. And our blog has case studies. Carrie has published so many case studies with all these different clients, therapists and the like. And then if you also want help setting up a phone tree on Spruce or using a virtual assistant with Spruce, go to help.sprucehealth.com. And I also just want to again emphasize, Move Forward is a partner that a lot uses Spruce. They're not part of Spruce. We don't offer virtual assistants in our services. We are just the phone and communication software, and you can use our system with any virtual assistant company. We just featured Move Forward today because we have so many so many mutual customers, and so we wanted to share kind of their tips and tricks with everybody on this call. Anything else to add on how they should get a hold of you? We will include these links, as well as the recording in an email follow-up to everyone that registered for this. And for those watching the recorded, hi, thanks for watching.
Yeah, no, this is perfect. They can, if they want to learn more and talk to us, I think we've already gotten some discovery calls scheduled while we've been on this webinar. They can go there. They can look at our pricing, our services. One of our core values is transparency. You'll see, our pricing. It's very simple. You'll see what we pay our VAs. That's all on our website. So, you can kind of, evaluate those things right there before you decide to book a discovery call. But we would love to talk to you.
Awesome. And lastly, I have to plug our next webinar because so many of you came here. So we hope to see you next month. And this is about simple strategies to boost your business this year. New year, we always try and make those new resolutions and improving our practice. And this is specific to therapists again. And you're going to be joined by Patrick Casal, who's one of those, he's a therapist as well as a coach, and he a strategist for practices. And so he kind of tells you how to help run your practice efficiently and kind of some things you should do this year. So please join us. Next month, you'll be seeing an email about that, also a link in the email back to everybody. So any last words? That we really appreciate both of you on the call. Carrie, I didn't know if there's anything else I need to say.
No, you guys were terrific. Jess, you covered everything. I love all the territory that we were able to cover today. So thank you so much.
Thank you. The only thing I wanted to make sure to squeeze in is before we really got a strategic partnership with Spruce, we did an independent survey of all of our VAs to find out what phone system they enjoyed using the most. And it was Spruce all the way. They love, as a VA, they love the ease of use and how they can navigate the support of their practices through it. So I just thought that was a really important perspective of how great this tool is. So
thank you so much. And thanks everybody for attending. We look forward to seeing you in Spruce, messaging our team. And if you need us, and if you're not a customer of Spruce, you can always email me at sales@sprucehealth.com. Or if you're a customer and you have a support request, it's support@sprucehealth.com. Thanks everyone.
Thank you.